If you're a doctor, nurse, or paramedic working at the sharp end of care in an ED or ICU or pre-hospital, then this video might help you appreciate that despite all the difficulties we deal with, our job can be really fulfilling. It's taken from a longer talk I gave a while ago, but I think there's useful stuff in it that we can all reflect on. Let's get into it. So I'm talking a lot about happiness and what makes people happy. And do we need to? Does it matter whether or not we're happy? Let's look at the science of human happiness. Now, I've researched this extensively with my team, and I've looked into it. And what I've come up with, having looked at the literature, is that it is actually worth being happy. It makes a difference. Humans who are happier have better lives in a number of different domains. So let's look at the science of human happiness. What makes us happy? Well, an interesting thing is that we're all born with a genetic set point that determines your chronic happiness level. And this set point determines about 50% of your chronic happiness. And there's nothing you can do about that. If you were born sad, you'll stay sad. If you were born happy, you'll stay happy. So what else can we do? What about our circumstances? Whether you're married or single, live in a sunny country or a rainy country, rich or poor, even sick or healthy. Surely your circumstances are going to determine your happiness. Well, apparently that only makes up 10% of your chronic happiness levels, your circumstances. And this is amazing, but it's true. And this is because of the human capacity to adapt. We show adaptation in all aspects of our neurology. The same way you can sit on the toilet for 30 minutes reading EMA, but the next person that comes into the bathroom will gag uncontrollably. That's sensory adaptation. We also have something called hedonic adaptation. There's the hedonic treadmill. You buy a new car, you get a nice house, you move to California. You're happy for a short period of time, but then your brain moves you back. The treadmill moves you back to the happiness levels that you had before you made that intervention, the hedonic treadmill. And that adaptation is good. That protects us. It keeps us from going crazy when our circumstances change adversely. All right, 50% genetic set point, 10% circumstances. What's the rest? This is the good news. The rest is your intentional activity. So these are things you can do. Circumstances are what happened to you. Attentional activity is what you can do in spite of your circumstances. This is an active process. In other words, stuff doesn't make you happy. Experience makes you happy. Doing stuff makes you happy. So owning that ENT surgeon's AMG Mercedes would not make you happy. Hot wiring it, going through some speed cameras and burning off the tires doing donuts in a car park probably would make you happy, an experience. And what are the intentional activities? Well, there's gratitude, kindness, and setting goals. The attitude of gratitude, being grateful for all the good things in our lives, makes us happy. Being kind to other people, particularly when these acts of kindness are at some expense to ourselves in terms of our time or our resources or our energy, that makes us happy. We're social animals. We need to connect. And then setting goals. And these goals are about improving ourselves, but in a way that's in keeping with the kind of person we want to be. So these are self-generated and self-concordant goals. These are the three things. So I've been a doctor for a while, and I did my first emergency resident job 21 years ago. And I'm still enjoying it. So maybe I've got some stuff to share to people that haven't been around so long. So here are the tips. It's an evidence-based guide to staying happy. Remember the gratitude, kindness, and goals. So be grateful for what you have. We do an amazing job, often in amazing places with amazing people. Most of us only work 40 hours a week. We get pretty good pay. We're well looked after. And we're valued, we're appreciated. We are there at a point in people's lives when they most need a doctor. What a privilege. We should be grateful for that. But then when we come home, we've got to remember that the job we do enables us to see life and death and the thin line between them, that fragile line between them, through such a lens with such magnification that we can't fail to appreciate how lucky we are to have our health, to have our loved ones still. We have to make the most of that. We have to have that attitude of gratitude. And we should never stop being kind. Never forget that person on the end of the needle or the end of the laryngoscope. That person who's every bit as amazing and complex and interesting as you are. Being kind. That element of giving will keep you happy and will keep them happy. And of course, setting realistic goals, but goals that will make us better people. Goals that might be professional, they might be educational, they might be academic, but something to aim for each month, each year, so that you progress in the career and you carry on loving it. Another interesting finding in the literature about these intentional activities is that when they become routine, they are less effective. You adapt to them. So they're more effective if you do them at varied times and at an optimal frequency that isn't every day. And what I'm hinting at here is I'm commending part-time working. Emergency medicine is a great job, but there's no shame in not wanting to do it every day. All right? It's healthy. It's healthy to do other stuff. And if we didn't, we wouldn't have retrieval medicine or toxicology or PDM or emergency ultrasonography or the teaching and academic stuff that goes on. It's because people are prepared to do other things with their time that we're able to expand emergency medicine. And that comes along to another recommendation I want to make. And you might not agree with this, but many people are in the habit of calling themselves ED doctors. I work in an ED, but I'm an emergency physician. There's no other specialty when you think about it that defines itself by the physical confines of the workspace. We're more than emergency department doctors. And you have to remember that with arbitrary time-based targets coming in, if you limit your expertise to the ED, you're going to be limited by both time and space. And I think that's a shame. I think that undervalues the contribution we can make to patient care. It undersells what we can do. It undermines our expertise. We need to learn to overcome these limitations of time and space, to transcend these time and space limitations.